So the question I have for you is, are really acute pain and chronic pain different? Over the past 10, 15 years, we've really come to the realization that acute pain and chronic pain are completely different animals. That in the past we used to look at pain, acute and chronic, and we used to differentiate between acute and chronic based off a timeline or temporally. So we'd start to take a look at it and say, you're at 1 week, so you're acute pain. You're at 1 month, so you're subacute pain. You're at 3 months, so now you become chronic, and everything thereafter, we said patients had chronic pain. So we looked at people on a time scale. We really learned that this is a disservice to our patient because time is not the thing that differentiates acute and chronic pain. It is not a time thing. So the question, can you have chronic pain at 2 days? Yes, there's a potential that you can be developing chronic pain at 2 days. And the question, can you have acute pain at 2 years? Yes, you can definitely have someone at 2 years who repetitively keeps injuring themselves and acutely exacerbating their pain. So to classify our patients based off a time scale is really doing them a disservice and is not what science is showing us these days. They are completely different animals. But the challenge for us is that we know how to treat people who have acute pain very well. We do that fabulously, and a lot of our education is based off treating the acute pain patient. The problem is then when we start to get chronic pain patients, we used to think that treating them was just taking an acute pain patient who had it for less than 3 months, and now they have it for 3 months or more, and taking the concepts that we learn in acute pain and applying to people with chronic pain and thinking that since they're the same thing, they only differ by time, then it should make them feel better. It should solve the problem. But now that we know that acute pain and chronic pain are completely different animals, we now realize that you cannot take acute pain treatments and give it to our patients with chronic pain and expect to have the same positive outcomes. And in fact, research is showing that we cannot take chronic pain and throw the same things we do with acute pain at it. So, how are they different? Well, it's interesting. When we start to take a look at the purpose of chronic pain, the purpose of chronic pain is very much the same. It's a protective response. But the difference we're finding in people with chronic pain is no longer is the tissue damaged. Because we know that musculoskeletal, all other major types of tissues generally take about 6 to 8 weeks to get better. So they'll heal up in 6 to 8 weeks. But in a lot of patients, they're having pain 2, 3, 4 years after they've had their initial injury. Now, in the past, when we used to think that pain was all the same, acute pain, chronic pain is just a temporal thing, the mechanisms were identical, we used to say, well, something's happened to that tissue and it's never fully recovered. It's still damaged. And so we'd also drive a lot of our decision making on trying to figure out what's that target tissue, why is it still injured, and let's correct that injury, and then they'll get better. But what we're finding with chronic pain, that it's not a temporal thing and they're completely different, like we said. So what's that difference? Well, really, no longer in these patients are the nociceptive systems driving. So there's not an indication of tissue damage anymore. But all those other sensations and sensory systems that were firing during the initial injury are still picking up and perceiving information. So a lot of times we're finding that these sensory things picked up from the context, the visual, the olfactory, the auditory, the interoceptive systems that we talked about just a second ago, they are still picking up information. And we're learning that a lot of times these other sensory factors, these other input factors that are being sent to the brain for processing now become triggers for chronic pain. And so in the absence of nociception, these other systems can then be processed in our brain and result in the behavior that we saw before, like pain, like movement changes, like postural changes, like changes in the autonomic nervous system, and changes in the immune system. So how does acute pain become chronic pain? Well, really, we're finding that it's reliant on the function of the brain. And a lot of the function of the brain is really about storing memories and learning. And so learning and memory is a huge part of what makes acute pain different than chronic pain.